Three. All right. Good afternoon, everyone. My name is Zach Wilder, and I'm a graduate fellow with Loyola Stands Against Gun Violence. I am also a graduate student studying public health here at Loyola. I truly appreciate you all joining us today for what is going to be an incredibly educational experience led by some of the foremost leaders in gun violence prevention. Before we begin, I did want to quickly run through today's agenda. We are going to be starting with a couple of opening announcements. Then we'll move on to some opening remarks from the Illinois Attorney General, Kwame Raoul. Then we'll move to the main point of our event, which is going to be the one thing you can do presentation on extreme risk protection orders, followed by a brief Q&A and some closing remarks. So moving to some quick announcements. We're currently doing a website revamp. So we have we've been doing a revamp, is updating and keeping everything up to date. You can check in there to learn more about upcoming events, view previous activities, and just keep track of the work that our partners are doing. Additionally, we now have an event calendar that promotes both our own events and the events of local organizations. So if you work with a community organization fighting against gun violence, you have an event coming up you want promoted, please feel free to contact us. You can contact me at zwilder@luc.edu. So do that, we can put it right on our website. And really importantly, registration is now live for our upcoming Community Advocacy and Violence Prevention Summit, which is on April 3rd. This year, we'll be discussing the power of voting, fighting for change, and advocacy strategies to reduce gun violence. Our keynote speaker this year is X Gonzalez, the co-founder of March for Our Lives and an intersectional activist. The event will include an advocacy workshop, a panel discussion, and an exhibitor hall featuring local organizations. You can register today at standagainstgunviolence.org. And then finally, I wanted to put on your radar our next event in our ongoing community conversation series, which will focus on domestic violence and the role of firearms. The event will feature Sarah's Inn, a comprehensive domestic violence agency working to support those affected by domestic violence and breaking the cycle of violence. The event will take place on Thursday, March 21st at the Cuneo Center on Loyola's Health Science Campus. Registration will be opening soon. All right, without further ado, I am thrilled to start our conversation about extreme risk protection orders by presenting opening remarks from Illinois Attorney General Kwame Raoul. General Raoul was born in Chicago to Haitian immigrants and brings a lifetime of legal experience and advocacy to the Attorney General's office. He first worked as a Cook County prosecutor before serving as an Illinois state senator for 14 years. In 2019, he was sworn in as Illinois' 42nd Attorney General and is currently serving his second term. The AG is a longtime advocate for gun violence prevention, having worked closely with federal law enforcement to prevent mass shootings in schools and places of worship, as well as fight violent crime across the state. Some of his most significant accomplishments have included promoting the implementation of new and existing Illinois gun violence prevention laws, such as a ban on assault weapons and high-capacity magazines, as well as the firearm restraining order law. So just give me one moment.
Greetings. I really wish I could be with you in person, but I'm in Springfield. I would like to thank the Loyola Stands Against Gun Violence Committee for inviting me to offer a few words on the importance of taking a multidisciplinary approach to dealing with gun violence. You know, my tenure as Attorney General was kicked off with my inauguration speech. In it, I called upon every public official to consider it a priority for them to contribute to combating gun violence. It is important to know that I was not shirking responsibility by putting the burden on other public officials. I started with pointing the finger inward at myself, challenging myself and my staff to do more than the Office of Attorney General had done historically to combat gun violence. We started with the creation of an internal gun task force, which called for us to break down the silos within our office. We created a standing monthly meeting where attorneys representing various bureaus of our office would explore how they could contribute and collaborate with other bureaus towards policy and enforcement efforts that could help reduce gun violence. Out of these meetings came a number of successful initiatives. See, we understood from our prosecutions of gun trafficking cases and murder cases that the guns utilized in violent crimes are neither manufactured nor legally sold in the communities where they are most frequently used and where they do the most harm. So we contracted with data scientists to create Crime Gun Connect, a state-of-the-art crime gun tracing platform that is used by law enforcement agencies statewide. We also realized from our task force exchange that while we had defended gun-related legislation when challenged for constitutionality, we had not historically utilized affirmative litigation against bad actors in the gun industry the same way we had with bad actors in other industries. We also partnered with the city of Kansas City and Everytown, and we sued to have the ATF revoke the license of a rogue gun dealer that was manufacturing guns for criminals. While this was a limited success, we realized that there were other bad actors in the gun industry, including those that marketed to children and others who were ineligible to possess guns. As a result, at the beginning of my second term, again during my inauguration remarks, I urged the legislature to give me the tools by way of our Consumer Fraud and Deceptive Practices Act to deal with those in the gun industry that marketed their products to children, illegal militia, and others in a manner harmful to public safety. Last session, the Firearm Industry Responsibility Act was passed by the Illinois General Assembly and later signed by the governor over the summer. It has since been challenged in court, and my office is defending it. We have also been active in both state and federal court defending the recently enacted assault weapons ban. While the assault weapons ban is important, it is also important to note that most gun violence, including mass shootings, is committed with handguns. Since early in my career, working as a juvenile prosecutor, I learned the perils of untreated trauma. Many of the juveniles who were arrested for committing a crime, after I did background checks, I learned had been in the building before as a victim of abuse and neglect, often occurring in their own homes. I learned from that experience that violence begets violence and hurt people hurt people. The untreated trauma from the exposure to violence can lead to a survivor of the violence evolving into a perpetrator of the same. That is why from the outset of my tenure as Attorney General, I've expanded the focus of our Crime Victim Activities Bureau to expand who we see as a victim. Historically, the office had often excluded certain victims of gun violence from services and resources by way of certain written and unwritten rules. Those who had made mistakes in the past were often excluded from services. We changed that. With the help of stakeholders involved in servicing survivors of crime, we changed. We believe helping prevent violence from happening in the first place is as important as helping survivors of violence in the aftermath. One of the things that I and my task force realized in our process was that it was unrealistic to believe that our office or even government or law enforcement at large can do adequate work preventing violence without the help of community stakeholders. The number of mass shootings has had a disturbing upward trend, no matter how you calculate or characterize what a mass shooting is. We have tried to respond by giving community the tools to prevent such incidents from happening in the first place. Since 2019, my office has partnered with the United States Secret Service's National Threat Assessment Center to conduct trainings for schools, institutions of faith, and other entities and individuals. The reality is that most mass shootings happen over the course of a few minutes, if not seconds. So the notion of preventing it after it has started is rarely achieved. We must use tools of detection to prevent them before they happen, before they start. While we usually focus on mass shootings happening at schools, places of worship, malls, places of employment, the reality is that mass shootings take place in private homes more frequently than they do in public places. That is a critical reason why our office has undertaken training law enforcement and others on firearms restraining orders. Firearm restraining orders allow for a formal legal process to limit an individual's access to firearms when there is evidence that the person poses a threat of immediate danger to themselves or others. The most important thing that any of us can do to aid us in preventing gun violence is to get to know the shooter. I often say that nobody came out of the womb with a gun in their hands and a heart to take the lives of their neighbor or their loved one. Something happens in the course of their lives to transform them into a perpetrator of gun violence. If we get to know the common traits and experience of a shooter, it is at that point we begin to know how to adequately invest in services that mitigate the risk of someone evolving into a perpetrator of gun violence. It is at that point we become serious about preventing gun violence. We also cannot be motivated to act only when there is an act of violence in a place, an act of gun violence in a place or neighborhood where we would never expect it to occur. If we're honest about it, we're honest with ourselves. We are more tolerant of gun violence occurring in certain neighborhoods. Usually such neighborhoods are neighborhoods of underinvestment. There should be no neighborhood where we expect gun violence to occur. And just like the opioid or the heroin crisis, gun violence will not be quarantined if we don't deal with it. It will spread if we do not adequately address it. Government and law enforcement cannot do it alone. We need all hands on deck. That is why I am thankful that Loyola has taken a multidisciplinary approach to making a contribution to reducing gun violence. Thank you so much for caring and for your contribution.
And thank you to the Attorney General for being so willing to provide opening remarks today. He did seriously emphasize that he wished he could have been here in person, but we're very grateful to have him virtually. Right. I would like to now move to the main part of our event today. I would like to introduce Dr. Tracy Kurtzer and the One Thing You Can Do campaign. Since 2018, the One Thing You Can Do campaign has been raising awareness about extreme risk laws. These laws provide an important avenue for intervention by reducing access to a firearm when someone in crisis is showing serious signs that they are at risk of harming themselves or others. While extreme risk orders are called by varying names in different states, they all serve the same important role to protect individuals and communities from gun violence. So as extreme risk laws are passed in more states, raising public awareness about them is crucial, which is what One Thing You Can Do does. They provide an overview of the life-saving potential of extreme risk laws and aims to familiarize the general public, as well as other important stakeholders about how they work in each state. We'll be covering the Illinois extreme risk law known as a firearm restraining order, or FRO, in today's community conversation. Dr. Kurtzer joined Moms Demand Action in 2013 and has organized various Wear Orange events, vigils, and gun buybacks in past years. Currently, she utilizes her expertise as a medical professional and director of trauma informed care and education in the Department of Obstetrics and Gynecology at Northwestern Medicine. And she's sharing information on the increased risks of gender-based violence and suicide-associated gun ownership. She also currently serves as the first Illinois Extreme Risk Lead for Moms Demand Action, where she works to educate communities on Illinois firearm restraining orders. Give her a round of applause.
All right, it's very nice to be here with you all, and as Zach mentioned, I'm an OBGYN. He did the long term, which is a tongue twister, so we just shorten it, OBGYN. And for 15 years, I was a solo practitioner and delivered thousands of Illinois kiddos. And I always would say, you know, it took a lot of effort to keep my patients safe through pregnancy, through delivery, and lots of gray hairs, lots of early mornings and gray hairs. But once those babies were born, to me, that was not the end of the concern or care I had for them. So I wanted to make sure that all of those kiddos, you know, grew up to have healthy and rewarding lives. And unfortunately, in the last, you know, decades, gun violence has just become such an overwhelming issue in our communities. And I appreciate all of you so much for being involved and active in these efforts that we are trying to make to change things so that all those kiddos that I delivered can indeed have their adult lives and safety. So the plan for today is I was going to present the One Thing You Can Do campaign, and I do want you to bookmark the website I put up there because it's really chock full of a lot of information. And I know some of you also may be from other states, and if you want to find out like what extreme risk laws are accessible in your states, or maybe there's some pending legislation that you want to advocate for, One Thing You Can Do really covers all of that. And then also I'm representing Everytown in that, and they have a wonderful website too, chock full of information. So I'll do the presentation, the set presentation for Illinois, which again is the firearm restraining order. And after that, I'm just gonna maybe spend a little bit of time, just some kind of a public health, preventative health perspective from a physician's viewpoint, and then maybe some things, a little more detail on the FRO, just because it is kind of covered briefly in the presentation. And then ways maybe that you can also get involved other than what you're already doing by being here. All right, so sorry, I have to kind of dual function here. Before I get started, I just want to acknowledge that I will be talking about topics, right? Gun violence, suicide. If at all you need to take a break, I totally understand it. Feel free to, you know, excuse yourself, and I will also stay over after the talk today, so we can do a little debriefing if needed. But to start the presentation, and I'm basically going to be reading this to you, sorry about that. So we may have different perspectives or experiences with the issues that we're going to be discussing today. But before we start, I think we can agree that there's nothing more important than the health and safety of our families, our loved ones, and our community. Everyone encounters difficult times, and there's nothing shameful if you or someone you know or love is experiencing signs of crisis. Everybody encounters those times, and friends and family are often in the good position to recognize the signs of crisis. And we more than anyone want to prevent harm. We never want to think about someone harming us. We love harming themselves. It's an upsetting and scary thought, but if someone in a family or household is struggling, it's often the people closest to them who are going to see those signs first. We're going to be more in tune to the situations that cause an emotional crisis to ramp up, and financial difficulties, serious medical diagnosis, or relationship problems. And, you know, some of you may have some ideas of some things that might trigger a crisis or, you know, some signs that you might see that somebody's in crisis. Anybody wants to contribute things that maybe if you saw in a family or loved one that you'd be concerned about?
Could you be a little louder?
So sorry. Yes. The question is, can you think of any signs that you might see in a family or loved one that would suggest that they're in crisis or struggling.
Maybe if their eating habits change, so if they're eating less, you might think that they might be entering a crisis.
Right, so behaviors changing, like kind of activities of daily living and stuff.
Yeah, maybe if they're hyper focused on specific things, stressing them out, patients with spiraling. So it's
Right, it's just like perseverating, you can't get it off from him.
Maybe consuming more alcohol that you've noticed on a daily basis.
Yeah, absolutely. Did I miss anybody? Okay, so these are, you mentioned a few of these are a few of the other, things that sometimes we may see, and it doesn't necessarily, some of these, obviously it doesn't necessarily mean, I'm sorry, it gets cut off on the bottom there, that somebody is going to be at risk of harming themselves or others. But if you see some of these signs and it's really different from the person and you're, continuing to exhibit them, just worth thinking about that. So, again, we also may have some different perspectives on the issues that we're going to be discussing. But again, there's nothing more important than those people that we love and keeping our community safe. Now, I want to say that if you see this in a family member or someone you love, the first thing to do is obviously to have a conversation with them and try to talk to them and find out what's going on, and encouraging them to maybe seek out help, mental health professional, primary care physician, if they're really an extreme crisis, going to the emergency room. But if you've taken those steps and you feel like the person really isn't responding, or you're not, getting through to them, and especially if they're starting to exhibit, signs that you're getting more worried, talk about killing themselves or harming others, which I'm sorry, it's cut off on the bottom there. Then when those signs of crisis are becoming so severe, you're really worried, then there's one thing that you should ask yourself. And that is, does your loved one have access to the gun? So why is this so crucial? And before we get to that, I just want to acknowledge that there are millions of responsible gun owners in the United States. Some of you may be responsible gun owners yourself, and they're definitely in our community. So choosing whether or not to own a firearm is a very personal decision. But when somebody is in crisis, access to a gun can make a difficult situation very dangerous, even fatal. And so we're going to talk specifically about this danger in relation to the risk of suicide. So there are two really important things that I want to communicate about firearm suicide. First, how tragically prevalent it is in the United States. You all probably know that, but if you don't, about it's nearly 6 out of 10 gun deaths in the United States are by suicide, and that's every year. Now, in Illinois, it's actually interesting. We actually have the reverse statistics. About 2/3 of gun violence deaths in Illinois are homicides, and it's about 1/3 that are suicides.
We can't hear very good.
So in Illinois, we have the opposite statistics. I was saying nationally, about 6 out of 10 of gun deaths are from suicides. But in Illinois, it's actually about 60% that are homicides and 30% suicides. And one thing about Illinois, however, is the rates of suicide have actually really gone up, even higher than the national average. So even though there's that reverse trend, it's still a very important thing to talk about. The second thing to understand about suicide is when it's done by a gun, is it's extremely fatal. Suicide attempts with a firearm, about 90% of the time, they're going to be fatal or lethal, whereas other means of suicide are not as lethal. So another thought is, or another kind of misperception is that when people try to attempt suicide, that they're uniformly going to do it again, whereas actually only about 10% are ever going to attempt suicide again. So intervention with that first attempt is so critical, and that's why I teach a lot of the healthcare professionals about this. About 50% of suicides are gun suicides. And although this might not be the experience for everyone, research does show that the vast majority of people who survive a suicide attempt are not going to go on to die by suicide. The bottom line is, if somebody tries to end their life with a gun, it's highly unlikely they're going to survive. But if the gun is removed from the situation, you give them a much better chance at surviving. Okay, so if you're in a situation where you see your loved ones struggling, if you fear they are going to harm themselves, and you've done the steps that were mentioned earlier, having those conversations and encouraging them to seek help, but you can't seem to reach them, what can you do? Consider a firearms restraining order. And that basically is the FRO, and the FRO gives you the ability to intervene if you're worried and you feel like somebody is in crisis, that they might hurt themselves or others. So let me give you just a quick overview of the firearm restraining order. It's issued by the court if someone is found to be at significant risk for harming themselves or someone else with a gun. It's designed to help family or law enforcement keep a person at risk from harming themselves. So those are the folks that can petition for a firearm restraining order. It ends up being issued by a court, and a judge makes that decision. It temporarily prohibits the person from possessing or purchasing firearms, again, just until the crisis is passed. And it requires any firearms the person has to be temporarily held by law enforcement or a third party while the order remains in effect. Firearm restraining orders are designed to help make a potentially dangerous situation safer while still respecting the rights of the individual. So before I go into detail, I know it's a lot to take in. A lot of the information I'm about to go through is also available on that website, onethingyoukando.org. And I'll go through a little bit more detail after this formal presentation. But some important things to understand about the firearms restraining order are: it can be put to use quickly. There is an emergency order, or so you can request that and have it applied usually within a day. And that immediately suspends access for that individual to firearms. That will ensure everybody's safety until the court has a chance to schedule a more thorough hearing at a later date to hear evidence and kind of get everybody's perspective. The other important thing to know is they are temporary. They don't permanently affect someone's ability to own or access a gun. And firearm remedies are that tool that keeps them from accessing a gun until the crisis passes. The other thing to know is that it respects due process. Although a court can issue an immediate restraining order quickly in those emergency types of situations, there's always a formal court hearing later before the order is completely finalized. And that gives somebody the opportunity, if they're the owner of the firearm, to prove that they don't present a threat to themselves or others. Those hearings in Illinois are generally held within 14 days. It is a civil order, so that means that a court decision on this and the order does not result in any type of a criminal record. And finally, and this is really important, the issuing of a firearms order does not require a mental health diagnosis. And this is really important for two reasons. First, the majority of folks that have a mental health diagnosis do not pose a threat of violence. Second, most people who die of suicide with a gun or who harm others with a gun do not necessarily have a diagnosed mental illness. But on the other hand, people who are exhibiting concerning behaviors often give some warning signs or speak about, some some of that before they act. And so that's why having this restraining order that a court can take into consideration somebody's actions or their behaviors or what they've been saying, and not rely on formal diagnosis of a mental illness. And again, this is why family, friends, loved ones are so important, because they're going to really be the people who are most likely going to come and see those changes in someone. So firearm restraining orders have been effective in getting guns away from people in the throes of a dangerous crisis. And a few real world examples of when they have been issued include a husband who threatened suicide when his wife told him that she wanted a divorce, a son who told his father that he planned to purchase a firearm to end his life, a son who told his mother that he wanted to end his life by taking pills or wanted to die by suicide like father. A man who threatened to end his life and that of his girlfriend and sent a picture of his gun. So each situation, a little bit different, but the common denominator is whether that person is suggesting that they're going to be a risk for themselves or for somebody else. And in that situation, removing the firearm at that time can be potentially life saving. And the firearm restraining order can make that possible. So let's pause for a minute and just acknowledge, this may seem like a drastic step, and it's obviously not the first thing to do necessarily, but when the time comes, it may, if you need to reach out to law enforcement or the courts, and especially if a loved one is involved. To be honest, I doubt anyone would do this as want to do this, but it is sometimes, the last resort that you have to save somebody's life. So they are really designed as a way to intervene when somebody is showing very strong signs of being at risk. So how it works in our state, and again, this information is available at onethingyoucando.org, so don't feel like you really have to commit everything to memory. But these are the basic steps to obtain a firearm restraining order. The first step is usually that you're going to reach out and contact a law enforcement, member of law enforcement. Or in Illinois, you can directly petition if you are a family or household member of the person posing the threat. So a family member is a person who's related by blood or marriage, and that includes ex-spouses as well. A person who has a minor child with the respondent or the person who's the gun owner, or a person who shares a common dwelling. So live-in partners, okay, but dating partner generally is not going to be a petitioner in this case. In this situation, if you went to law enforcement or you went to the petition of court, you're going to need to share why you feel this person will pose a significant risk to themselves. Again, recent behavior changes, threats of violence or harm, whether it's warning signs we discussed. And in that crisis situation, again, if it's very urgent, the court will issue that emergency order. That's going to immediately suspend that individual's access to firearms until the formal hearing can be held. If they currently own any firearms, those would be held by law enforcement or a third party for as long as the firearm order ends up being in effect. The temporary orders, those emergency orders, again, usually the final hearing has to happen within 14 days. So that only lasts for up to 14 days. After the hearing, the court judge will evaluate whether the final order is indeed required. And then the person who is the subject of the order at that opportunity has the opportunity to contest the order. So it is an in-person hearing. And then if the final order is issued, the person is prohibited from possessing guns for the duration of the order. Generally, that's going to last for no less than 6 months up to a year. But there are opportunities that the individual can petition the court for an earlier date to have it revoked. So after the order is issued, the biggest benefit of a throw is that it temporarily prevents, again, somebody who's in the midst of a crisis from getting their hands on a gun. Once the order is issued, the person has the time and space to get the help and support they need to move past that crisis. And if the person continues to exhibit signs that they might be a danger, then the order can be renewed at the end of the period. Renewal of the order is going to require a whole nother hearing. The court has to hear evidence all over again. The person can obviously contest at that time. That basically, once it expires or once it's terminated by the court, the individual will get their firearms back and they'll be able to, again, legally buy and possess firearms. So again, the issuing of this also does not result in any type of a criminal record. Attorney General Raoul referred to this, but the Bipartisan Safer Communities Act was passed in June of 2022. And it gave states $750 million over 5 years to implement a range of crisis intervention programs. It aims to combat gun violence and includes provisions that will help access to mental care and equip schools with the resources necessary to keep them safe as well. States that receive grant funding can also use this money to fully implement their extremist laws if they have one. That can include launching a state coordinator, public awareness campaigns, mandatory training programs for relevant government agencies. I know they alluded to the training that is going on with law enforcement agencies right now. If your state does not have an extreme risk law, agencies can still prepare to respond using that money in various ways, like for different background checks, raising age, different opportunities there. And local governments still can apply to community violence intervention programs as well. State agencies can use the new $300 million that was released in grant funding for education about secure gun storage, threat assessment programs, school security and emergency planning, as well as investments in mental health services. So to conclude the one thing you can do, I just want to reiterate that we all want to keep our families safe and healthy. Hopefully this presentation will leave you with understanding that the firearm restraining order is a tool that it gives you the power to do something about a situation that may seem to be spinning out of control. And again, just a potential way to keep a loved one, somebody you care about, to keep them from getting their hands on a firearm until their crisis is passed. And you know, you are the person who knows your loved one best and can potentially save their lives. These are just some more resources for support that are handy to know and be aware of if you are trying to help someone. And so that concludes that formal presentation of the one thing you can do public safety campaign for the Illinois Pro. I'm going to hold questions. I think we have time to that end, and I want to just switch gears now and go into a little bit more detail just about the use of pros and the larger public safety ways that we can think of it as a preventative health tool, and a few other scenarios that might come up that you can think about it, other things too. So I'm so sorry I didn't advance on that. All right, so what I will cover is just the, gaps, like why do we even need to have these extreme risk protection orders, basically. They're filling a gap in federal law, and then to better understand how the Illinois works and how you can use it in different situations, and then how you can get involved if you want to be part of that campaign. So the federal definition or federal law, basically a person is only prohibited from owning a firearm if they meet one of these categories, and that would be convicted of certain crimes if they have a felony record or domestic violence misdemeanor record, if they're under a current domestic violence order of protection, or if they've been adjudicated to be a danger to themselves. And a person who displays warning signs of suicide or other acts of violence, but who's not prohibited under one of those three categories at this time is not prohibited by federal law from owning a firearm, possessing or purchasing a firearm. So those state laws really are just filling in that gap for these particular situations. pros across the country, where in the states where they have them, they're all civil court orders. They're all temporary, so that they, are not permanent restrictions on gun ownership. But the details of them very much differ from state, so that's why I referred you back to the website, so you can learn about your own state if you are not an Illinois resident. Petitioners are pretty much across the board are going to be law enforcement, but in some states like Illinois, family members, and Illinois also household members, as I mentioned, are included. Sometimes in some states it may be just the spouse and not ex-spouses. Illinois amended their FRO a couple of years ago to include ex-spouses. In some states, healthcare professionals are potential petitioners, or educators can be potential petitioners too. Basically, when that happens, if your state requires some type of firearm identification or concealed carry identification, those are revoked at the time of the order. And most of the states do have those emergency or ex parte, as they're often referred to, types of orders, and then followed again by like the formal hearing and formal order. The length of the duration of the order, that also can vary between states. This is just kind of a little flow sheet that basically has been reviewed already, so I won't go through that. But these are the states. Right now there are, as of 2024, 21 states that do currently have extreme risk orders and order laws. And the ones that are marked in dark blue are listed there. There's some of them. And the Bipartisan Safer Communities Act of 2022 was the first major federal gun safety legislation passed in nearly 30 years. I find that very sad that it's taken that long, but they did do that. Again, it's provided a renewed surge of trying to get information on extreme risk protection orders out there. A lot of community safety, promotion for community safety and funding for that, and then urban education and expansion. The good news is that most red flag policies here, we try not to use the term red flag, but emergency risk policies actually have broad support. The majority of people who've been surveyed either somewhat or strongly approve of family members or law enforcement petitioning for extreme risk laws. So do they work often comes up, and here's a few of the statistics. Of course, there's not often a lot of just detailed statistics, but in some of the medical literature where there have been some documentation of outcomes as well. In California, for example, just like how are they being used? Their first 100 gun violence restraining orders that were issued from 2017 to 2018 were analyzed. And the GVRO is their extreme risk law. And in that state, 40% were for domestic violence or stalking, 25% for suicide risk, and 18% for dementia, PTSD, and mental health issues. Connecticut, which was one of the early adopters of extreme risk orders, researchers estimated that it took about 10 to 20 orders to prevent one suicide. And over the 10 years following the extreme risk law taking in effect in Indiana, also a very high adopter state, interestingly, and in that state, there was a 7.5% reduction in firearm suicides. So that's really significant if you think about that over the cross of, that was across the country, a huge difference that would be. And again, these are in situations where it's not even really widely, always really widely in the communities. So these are a few of the high risk situations when I normally teach healthcare professionals about awareness of the pro and maybe encouraging patients or family members to seek help through, law enforcement or to petition themselves. So certainly, as we talked about mental illness, suicide risk, impaired cognition, dementia, and then domestic violence or other threats of violence would be kind of the big three categories. So again, just a little more detail on suicide, as you already know, suicides make up about 60% of the gun firearm deaths in the United States. And having access to a firearm increases the risk of death by suicide by threefold. And interestingly, firearm suicide is actually higher in rural areas as compared to urban areas. And part of the reason for that may be because of this graph. And I'm sorry, I'm like totally not advancing slides here. I apologize for that. Not a good multitasker, clearly. So firearm suicides are 3 times higher in homes where there's actually a firearm. Suicides are 3 times higher in homes where there's a firearm, and more common in rural as compared to urban areas. And then this next slide just kind of shows why that's true. And that box on the bottom, basically the red line is firearm suicide deaths per 100,000 population. The green line is non-firearm suicide deaths per 100,000 population. And then the bottom on the x-axis is the percentage of the population that owns a firearm. So as basically suicide rates are higher overall, it's actually the firearms that are driving the rates being. Suicide is the second leading cause of death. Suicide by firearm is the second leading cause of death for individuals less than 35 years of age. And 1/2 of suicides, as we know, are carried out by firearms. And it is the most lethal attempt, and that we covered before. Males who live in a home where there is a firearm have about a 10-fold risk of suicide as compared to not a firearm in the home. And basically having that firearm in the home increases the risk for all the family members. So not just the gun owner, but spouses, children, a 3-fold higher risk of suicide for those individuals. And just kind of touching a little bit more of that magnitude of the problem in young folks. In 2020, suicide was the second leading cause of death for kids that were 10 to 14 years old, and the third leading cause of death for people that are 15 to 24 years of age. 1 in 4, 25% of adults, young adults that were surveyed, and were 18 to 24, so they had considered suicide in the previous month, and that was in the height of the pandemic in the summer of 2020. So I realized, a lot of extenuating circumstances there, but that's just really tragic. And these graphs that are there really just kind of show the magnitude of the problem and how much increased suicide rates are now. And what also has increased over this time, firearms, right? With the pandemic, there was a doubling in purchasing of firearms in the time period. Another thing that I think just came out, kind of hot off the presses is the risk for exposure to gun violence and the risk for suicide. And this was a study that was done, a survey of Black adults who had been basically surveyed for their exposure to gun violence, and that would include being threatened themselves or just witnessing or having somebody that they knew had been shot by a firearm. And overall, there was a 40% increased risk if an Black individual had that exposure in their lifetime. If they had been exposed to 1 act of gun violence, the relative risk was 1.69. 3 or more acts, the relative risk is over 2-fold. So the author of that paper, and of course, this was a type of study where there can be other extenuating circumstances or issues that, so it's about causality, but it just kind of brings to a point that gun violence is not just a problem of public health, but it actually operates to influence and shape public health as well. Also a good point to bring up here is that we have to be really careful with extremist laws, that there is not biases into who is, the petitioner, the respondent, and that there's not basically, disparity in how those are issued, because of racial biases too. So that's something that as, you know, the judges, as courts, as maybe people who are recommending that we just need to be aware of our potential biases there. So another problem I mentioned was dementia and impaired cognition. And some of the statistics there that I think are somewhat surprising when I relay them to other people, is that 33% of individuals who are over the age of 65 and 60% of individuals with dementia live in a home with a firearm. And in one study, 1 in 3 patients with dementia had access to a firearm. 91% of older adult suicides are by firearm. So they are far, you know, always that 50% that is the national rate. And firearms are used by 73% of people with dementia for suicide. And caregivers are concerned about that. Like they realize that this can be a problem, but only about 53% of them did something to change access for that individual that they were caring for that had dementia. I'm so sorry. I totally am messing this up. Somebody needs to give me like a. So this is the data on older adults. And these slides I can actually share with you too, since I've been messing it up so much. So domestic violence, basically, you know, or other threats of violence, definitely the throw can be thought of as a tool in those situations as well. And I know that's a topic for next month, so I think that can be just postponed and maybe discussed a little bit more than that tonight. All right, so just a reminder, and you know, the situation, if you're concerned about somebody sending your loved one or something you care about to the emergency room, if they're acutely suicidal, there's resources available, of course, but having that conversation with somebody that you care about who's at risk may seem kind of daunting. So here are a few suggestions. First is just, you know, present your concern and educate the person. You may not, you know, just why are you worried about them? And why are you especially worried about them because they have a firearm? I think emphasizing that preventative safety for the individual is always helpful, but quite honestly, when somebody's suicidal, that might not resonate with them, right? So sometimes bringing up how that might impact other people in their lives as well. Using sensitive, non-judgmental language that's of course culturally appropriate. We're not anti-gun, we don't want a firearm used in that situation to have them be heard or somebody else. Focusing on the condition and the situation as being high risk, not the individual. And supporting person-centered solutions. So maybe they are willing and open to relinquishing their firearm, maybe having another family member hold it for them, or having some type of safe storage for a period of time. Orders of protection can then, you know, be offered as other options, or really used as a last option. If a firearm restraining order seems to be the best approach after you've tried your intervention, again, as you can be a petitioner as a family or household member, or you can reach out to law enforcement to be that petitioner. It can be filed in the county where the respondent lives, or where maybe the threats have occurred. Again, the emergency hearing usually happens within a day or a court day. And then if the judge will issue it if they feel like they agree that that person is indeed an immediate and present danger. The formal hearing is then set, and then at that point, the respondent does have the opportunity and due process to come in and defend their right at that time to continue to possess a firearm. The evidence that's required as a petitioner is actually greater than the burden of proof that's required by the respondent. And if there's a false petition, so if any information is put on there that is not true, somebody, the petitioner can actually be charged with a felony of perjury. So that really inhibits, I know a lot of the concerns when the firearm restraining order came out is that people are going to use it frivolously, they're going to use it for retribution. But the reality is if somebody is not doing it in good faith and with, you know, some valid indications or lies about what's going on, there's a serious penalty for that. The other thing that's important is that the petitioner needs to make a good faith effort to provide notice to any and all intimate partners of the respondent and of their plan to petition for firearm restraining order. So that comes into play a role, certainly a little bit more in those domestic violence types of situations. Because if somebody may be threatening violence, then the individual who the threat is against really deserves to know that. So that is a part of the problem. Okay, and this is what the court order actually looks like. So basically, as the initial page, kind of general information: who's the petitioner, who's the respondent. Second is the relationship code, just to double check and make sure somebody does apply, does qualify as a petitioner. Any known firearms is that last part of the second page. Then the third page is that description of any of the incidents or things that you felt maybe were, you know, threats or behavioral changes or things that you had seen. And then this last section is just checking off what remedies we're going to apply. So I always like to dedicate my talks to different people. This one I thought applicable is Dr. Laura Brady. She was a New York physician who committed suicide during the pandemic. Because a lot of healthcare professionals were also impacted during that time, committing suicide, unfortunately. So I always like to, you know, think about people who did service to others and think about what you can do next. So if you are not already, you know, part of a national or local organization, I've listed a few there, and I'm happy to make connections. I have some contact or connections with somebody in all of these organizations. If you want to know, you know, they'll kind of cover a little bit different things here and there. So if you have questions about them, feel free to reach out to me. You can also teach in community settings, right? I've done a few of these for a different organization called Speak for Safety in some of the different districts, you know, just like community events with your alderman. That's a way to get information to the community. Getting more comfortable with that process of asking your family and friends about suicide risk and other high risk situations. And I listed a few more that might be applicable for gun violence there. And then any, you know, testimonials. I think anytime we speak out, gun violence prevention events, letters to the editor, writing about your own experiences, you know, posting on social media, I think the more it's talked about, the more we get the word out as well. And I think it's just important to be, you know, safe when you're doing that. Be sure that you're, again, culturally sensitive, that you're not necessarily anti-gun, but if there are situations where gun violence is really under control, we need to have some regulations in place. So just being safe with the work that you do as well. All right, and I don't have any disclosures. This is my contact information. If you did want to reach out to me, a few of the different organizations that I represent. Thank you. Okay, so Doctors for America, if any of you are in healthcare, not just doctors, but any healthcare, does a lot of great work and really looks at the intersections of gun violence and different public health issues. Everytown, of course I'm representing today, but Moms Demand Action and in Illinois, I mean, Illinois is one of the oldest gun violence prevention organizations that actually started the community education on Pro back in 2019. The Network Against Domestic Violence, which held a task force on Illinois, Floyd and Pro in 2021, which was the basis to a lot of the updated changes in the law in 2021, and they're working very hard on to do some more updates in laws as well. So I will leave it there and take any questions.
Thank you for presenting, by the way, I really enjoyed it. Very insightful. I'm just building chat for people online. One of the first questions, it's kind of twofold, but can you petition the court for a FRO if the firearm in question is not owned legally? And then what would be the consequences for the gun owner?
Yes, right, you can, but the consequences would be much greater because once the, especially, you know, through law enforcement and through, if you go petition directly, but then through the judge, ultimately that notification goes to the Illinois State Police. A law enforcement officer does go to relinquish the firearm and give the order at that time with the court hearing date. So at that point, that person, if they're an illegal gun owner and they don't have a firearm ID, is breaking the law. So. Yes.
If the individual who's in distress is a minor and the parents have a gun in the house, is there any sort of protection you can put with that, even though the minor legally can't possess the gun with their parents here?
Right, so like if you're worried about the minor.
Yeah, if the minor is having mental health problems, like, is there any way to protect those things?
Yeah, I mean, technically it is the owner of the firearm. So it can be a little challenging in those situations because you can't petition the parents of the gun, even though it's, you know, their name is exhibiting them. But you can notify law enforcement about that to do, you know, an investigation. It wouldn't be through a court order type of situation like that. But as you know, as healthcare professionals, for example, we have a duty to warn. So I had a patient who told me that they were worried about you know, somebody in the home, their child who had been threatening suicide, and I knew that they were a firearm owner. In good faith, I could, you know, to protect that person, I could certainly do a notification to the police. I'm sure, you know, a good Samaritan or, you know, friend or family member could do that as well. But not through the firearm restraining order.
Another question from the chat. Are petitioners protected in any way? Are these petitions ever kept confidential due to possible risk of petitioners?
They are not, and that is one of the, I would say, negative aspects of the PRO is if a petitioner goes through that, their name is on that petition. It is open information. So to the respondent, it's not hidden from the respondent. So that is why actually some, and also it sets up that situation for, you know, a court hearing where somebody, two people who maybe, you know, that they have to face each other in court in that situation. So if it's a problem like that, that's why it's sometimes better to go through, if you have concerns about that, go to law enforcement. They can be the petitioners on record.
When you were discussing pros, I saw that you said it can often, the gun can often be held for 6 months. Is there any possibility of that individual purchasing a gun through some sort of gun distributor? Like, are these two departments kind of siloed, or are they in communication? Is there some sort of system that allows them to know that there's currently a pro in place on that individual?
You know, so the first of all, the PRO would be minimum of 6 months up to 12 months. But it's the petitioner, unless the respondent requested an earlier hearing to have it revoked. But At that point, when the order comes through, whether it's the emergency or just a regular hearing, the firearm ID has to be surrendered.
Okay,
So technically, by law, that individual would not be allowed to purchase, in Illinois at least, purchase a firearm.
thank you.
That doesn't mean that they might not
Right.
happen, but they're not supposed to. And there is communication that goes immediately, like I said, to the IS, the Illinois State Police database. So if through legal means, if somebody's having a background check, it's going to flag that they are not a firearm ID owner anymore. And that happens, I wouldn't say seamlessly, but I think it happens relatively well, and they are working at the law enforcement side to improve that as well.
Kind of going off on that question, say the person does buy another gun illegally during the time where their gun is taken. Are there any house checks that happen to make sure there's no guns or?
It's in the honor system. However, if they are caught in some way with that, or they're reported on, that there'd be pretty serious charges for that. But waiting the throw and not having a valid ID.
Another question is, what does training for law enforcement look like?
Yeah. I might not be able to answer that question fully, but I do know that there is a requirement now for all police departments to have training, and I know our Attorney General actually and his state's attorneys are doing that and definitely getting the word out. So that's more their side, and then there's the community and both their side.
I'm curious if you know how often healthcare providers are involved in the roles of petitioner on behalf of their community.
Yeah, not much in our state, just because we're not petitioners, but and I think it's been not really taken up a lot by many, because, and this is another challenge with having healthcare professionals, is there is that requirement, if you're going to be the petitioner, that you have to show up in court. And that's not, and so unless there's a situation in the law that allows for a representative, that can be very difficult for healthcare professionals to do. So oftentimes, again, it may be more that they're going through law enforcement channels to get that done. But they have that option, which is I mean, it's nice, I think, just to have a variety of options. So it's nice to have that as a law, but I think realistically, it's probably not going to be a very common approach for petitioning.
I think I saw a slide that the law that in effect since 2019.
Yeah, it passed in 2018, but went into effect 2019.
Has it been given a sense of how much it's been used?
Yeah, and part of the reason we're really pushing on this is that it hasn't been a lot of uptake in Illinois, and I don't have those numbers like off the top of my head, but given what in general, what how we rank as far as gun safety laws across the country or out there, it is kind of interesting. One of the theories, and probably a pretty reasonable one, just based on some of the data out there, is if laws like this go into effect without funding for the education part of the campaign, they're not taken up very well by those states, and the states that the funding was part of that original law, like Florida and Illinois, they have really high usage of extremist laws in the states, but the funding came right off, right when the law came out. And so part of the amendment that came through the 2021 amendment was to help fund some of the public education too.
Actually, kind of a sort of related question. Do you know whether this law has been challenged before?
I don't believe it has. I mean, I don't know 100%, but I have not heard of it, so I don't think so. And as I showed that graph, I mean, actually most people are in favor of extremist laws, and So there's always the lobby and opposition to any type of gun safety laws, but, you know, if they're representing their members, I would imagine probably many gun owners who might be members of those organizations would be in favor of extreme response as well.
So in doing this, it just takes away the gun, it doesn't like provide any sort of like mental health services besides taking away, okay.
It's just really the maintenance so that person can get whatever services they need, always with this, put some separation between the threats or behaviors.
Are there any numbers that you're aware of how many guns are bought legally and how many are not illegally?
I don't know those numbers. You mean just in Illinois or?
Just out of curiosity, I mean, are most guns bought legally or are they obtained guilty?
I think that would probably be a hidden statistic because we don't know about the ones who are bought illegally, right? But if you look at crimes that happen in Illinois, quite a few, I don't remember the statistic, but maybe 30% when those guns are retrieved, they're not legal, they have not been legally purchased.
Because if it's illegal, then that person is not gonna get that cut off because they're losing. Then they're losing over much money they're paying for. So I've read that there's resistance on the side of the police officers to go in there. For fear that there'll be, you know, combat kind of situation there because the guy's not gonna give up this stuff.
That's always there is.
So I don't know how well it's enforced.
Well, the states where it has been taken up, I mean, there is enforcement and it isn't, I'm not aware of any instances where there has been a situation like that. But it's the same situation when law enforcement goes in, you know, for like domestic violence situations, or there's always that risk of it coming in contact with a combative person who has an illegal gun. There's so many firearms and there's all the legal firearms. I don't think that fear should take away from having an option to, you know, have an order in place that allows this to happen.
Just kind of a couple of points that may have the tables and the Loyola Senate does this. In Illinois, our senators work with the state to apply for the federal funding that's been made available through the program that was described. To answer your question, since it's been implemented, there's about 400 of these that have been implemented, so a relatively small number. There's increases when something happens that makes people aware of it. So after the shooting in Highland Park on the 4th of July, there was a dramatic increase because people were aware of it. So states developed a plan on how to use money that's coming from the federal government. It's going to be about $10 million the first year, and then 10 million a year will be used after that. A lot of the money is going to go towards training. To the point, law enforcement is aware of it. Oftentimes, people in law enforcement leave and people come and there needs to be that training. But one of the things that's lacking that you alluded to is the resources to actually enforce this are fairly extensive because it requires the police to often go to individual residents, search for guns or obtain guns, just stuff like risky activity. So it's not just they mail them the court order and expect them to keep them in. But then the last use of the money, somebody asked about services for people. There is money that's been set aside to figure out how can individuals who are in need get better linked or connected with supportive services. So if people are interested in learning more about this or getting more involved in some research around it, feel free to reach out to us.
Does everybody know about Loyola stands?
Yeah, so so in the firearm restraining order itself, there's not provisions for directing people towards any services that they might need, that it funding, it sounds like, is there to help with, maybe some enhanced services for things. Right, well, I'll stay over, as well later, so if anybody has any other questions or comments, that you want to take over and do a final.
All right, well, thank you so much for attending today. We truly hope you enjoyed today's event. We have to come away feeling more knowledgeable, more prepared to go out in your community and recognize and prevent gun violence. If you enjoyed the conversation, I highly encourage you to join us next month for our next conversation in the series. You can register that soon on our website, which is standagainstgunviolence.org. And then also keep in mind our 5th annual Advocacy and Violence Prevention Summit on April 3rd. Thank you all for your support. Have a great night.
Oh, man, I was actually something. No, it's well, it's something we always have to mission part of the local. That's not. Thank you so much.
Yeah.
I'm sorry, but thank you.
I know.
I'm